I'm Dr. Ron Miller of cashbasedphysiotherapy.org, and we're going to talk about what I did with my FIOMPT lecture today. So, as you know, I was invited and I had the honor of speaking at the Florida Institute of Orthopedic Manual Physiotherapy, their first annual orthopedic conference. It was a great conference. I highly recommend it, and I was presenting on direct access and physiotherapy. So I posted to the Facebook page, and a lot of people were asking about what my lecture was about. So today we're going to actually go over what my main points were. And initially, my introduction, I just wanted to really get to the point of physiotherapists. We have to think outside the box, okay? If we stay with our old model, with the old mindset and our old belief system of we're just a pawn on the chessboard, we work underneath physicians and standard care, seeing double and triple booking patients every hour, we're going to get the same outcomes. So what I wanted to see was, I wanted to highlight this, is that old model, that old mindset is really dealing with just a small percentage of the actual market. And some of the research done by Fritz et al., and there was a bunch of other studies too that I quoted and referenced, where that old model is really dealing with maybe 7 to up to 16% of the actual healthcare market of patients who would best benefit from physiotherapy services. A lot of the research on lower back pain supports this. So what I wanted to get with my introduction is, we need to break out of that old mindset, break out of that old pattern, and tap into the bigger healthcare market of people who will truly benefit from physiotherapy. Not everyone needs surgery. And identifying our bigger market and going after it with direct access and marketing to the public. So my introduction was pretty much based on that. And pretty much I went over 3 main topics: the legal aspects of direct access, and what does our Practice Act say, or what does your state Practice Act say that you can and cannot do. The second part of it was actual medical screening. If we are going to market to direct access, are we trained medically in identifying risk factors, identifying the signs and symptoms of cancer, and can we correctly perform medical screening to know when to refer these patients out? And the last part was 5 tips to help tap into the direct access market. So the first step is this: can you legally see direct access? You have to know your Practice Act, your state Practice Act up and down. It's going to guide you in what you can and can't do. Do you have direct access? Can you do needling and stuff like that? So here in Florida, we have 21 days of direct access if they've never been seen by a practitioner of record. Now, every state has a different law on this, but you have to understand, no matter what state you're in, you have to know your Practice Act. And it's going to tell you your direct access laws. Many states have some form of direct access now. So look over your Practice Act, make sure you know it up and down, and it's going to tell you, can you legally see direct access or not. Most states, again, have some sort of direct access. So the second part of what my lecture was about was medical screening. And if we are going to tap into this direct access market, we need to know medical screening. So I clearly showed that in our training now in the DPT programs with fellowships and residencies, that we have the training that we need to see direct access patients, and we can identify medical red flags by doing the proper medical screening. And the case that I highlighted was the VBI. There was a lot of, it's the most popular one, I guess. Can we identify it? What does the evidence say that we should be doing versus that we don't have to be doing? And I highlighted that because that's the most controversial. And Roger Carey is actually doing a lot of the research with that and some great stuff. And I highlighted, and I believe FIOMPT actually published guidelines. They were set in 2012. They were published in Manual Therapy in 2014. But if you don't have access to that, send me an email. I'll send you the PDFs. This is the gold standard on what we should be doing with VBI and CAD testing when we're dealing with cervical neck pain patients, headaches and stuff like that. There is the gold standard's written. You just have to implement it. So if you don't have access to it, send me an email. I'll send you the PDFs. It's a great read, but this is what the current evidence says and what we should be doing with VBI testing. And then I went on to say, you know, that we are trained, we are competent in seeing direct access, and we know when to refer. You know, we can implement the Ottawa ankle rules. We can do the evidence behind VBI testing. We know when to, you know, the signs and symptoms of cancer, the 3 highest risk factors, you know, when someone could be having cancer or when someone just isn't responding to treatment. We know when to refer out, okay? So the last part of this was 5 strategies to tap into the direct access. And I love this part of my lecture because if you don't know who Beef Johnson is, he's a golfer. He I believe in the Open Championship, he scored in the top 5. And this scraggly old guy who I guess golf now caught in a New England pub. He was wearing a Pittsburgh Pirates hat and a Wu-Tang shirt, and they came up to him, he was drinking beer, and they started talking about chipping. And that like millions of people followed this. But when I post a video on YouTube or Facebook talking about the keys to fixing shoulder pain, no one follows it. So physiotherapy isn't cool, and how do we tap into this market when people aren't going to easily follow us? You know, our market and our business that we're in, you know, it's not cool to follow us on social media necessarily. It's not cool. You're not going to check in and say, hey, I have pudendal neuralgia, I'm getting treatment here. So how do we tap into this? And I went over 5 basic strategies that we can use to tap into direct access. So the first one was to actually identify your niche market. And you've heard me say this so many times. Stop just generally, you know, marketing to physicians and just say we do physiotherapy. Identify your niche market. You know, identify who are you great at treating, or what type of patient do you want to come in your door, or what do you specialize in. Identify that and go out and get them. Design a marketing strategy to go out and get that patient. Identify people that best benefit from physiotherapy. Identify that niche market, that type of people, and go out and get them. Market to that people. That's what we should be doing, not general physiotherapy marketing. Okay, if you're just generally marketing physiotherapy in a cash-based clinic, you're going to run into poor conversion rates and people who are just looking for physiotherapy, but they don't want the best. So what I recommend, first step, is to get out there, identify your niche market, and go after them. Okay. Second thing is, again, this kind of supports this. Stop selling physiotherapy. Okay, people don't know what physiotherapy is. They think we're glorified personal trainers. Stop marketing physiotherapy. Start selling the outcome. And there's a perfect example of this, is that I have this window perf on the back of my vehicle. It says, Pursuit Physiotherapy, better outcomes, whatever, call now. If someone didn't know what physiotherapy was and they pulled up behind me, actually in 3 years I've never gotten a single lead from someone saying that they saw my ad on the back of my car and they called. But for example, if someone pulled up behind me and saw my ad, they'd probably be like, that guy's a physiotherapist. Don't know what that is, or that's post-op rehab exercise stuff. You know, but if I wanted to target plantar fasciitis patients, you could be like, resolve plantar fasciitis without injections or surgery. Call now for our proven recovery process, and your phone number. You know, maybe in 3 years, I would have got 3 phone calls, you know, of people who have heel pain because of that. So stop marketing physiotherapy and market the outcome. That's the goal. You know, we just happen to get people better. We just happen to be a physiotherapist. People don't care what you do or how you do it. All they care about is why and the outcome. So I think I went into, yeah, there's a great TED Talk by Simon Sinek about why. And it goes into leadership and stuff like that, but it really opened my eyes about marketing. Charlie, well, that ruined that one. And the next one, the third strategy, is to change your website. Your website has one goal, and the one goal is to take that prospective patient and get them to call. Get them to take action. It's not about you, it's not about your credentials, it's not about your training, your special magic pen light, your traction machine. It's not about anything accept the patient. And it really has one goal. The goal is to take that patient who's visiting your website and get them to take action, plain and simple. So if your website is not getting conversions or people are not calling, you need to fix your website, because every physiotherapist website looks the exact same. It's all about you, your credentials, your training, your interventions, everything. And it really should be about the patient. So fix your website. The fourth thing is, let's face it, we're in an oversaturated market. Okay, there's a million healthcare providers. Okay, there's chiropractors, acupuncturists, massage therapists, personal trainers calling themselves corrective exercise specialists. There's physicians everywhere, there's DOs, let's see, there's hospitals, ACOs. We're in an oversaturated market. When someone needs treatment, how are they going to find you? Okay, so the question is, one, if someone's searching on a local search, are they going to find you? Are you popping up in the local searches for certain treatments, lower back pain, plantar fasciitis, shoulder pain, whatever you want to specialize in? Make sure that you're coming up on local searches, whether it's your Google business page, whether it's Yelp, whether it's just some SEO on your website to educate the patient. Make sure that you're popping up on local searches. And if someone searches for low back pain treatment and Google lines the top 10, how are you going to stand out amongst everyone else? What's going to make you stand out? So you got to make sure that your page looks better and stands out a lot more than everyone else's. Okay, so a perfect example is this. If you search for best Orlando physiotherapists on Google, 10 physiotherapy clinics come up. Pursuit has roughly, at this time, I believe, 93 5-star reviews. The second person in line maybe has like 9, and then one person has 3, and the rest doesn't have any. Those 90-some reviews are making myself stand out, and my page stands out with pictures, educational content, videos on there. My page stands out more than everyone else's. So that's my point, is how are you going to stand out in an oversaturated market? And when people are doing local searches for you, make sure that you are standing out in an oversaturated market. The last one is plain and simple. In a cash-based clinic, if you're showing the same outcome and giving patients the same experience as in standard care, you're not going to thrive. You have to show better outcomes and fewer visits and give the patients an unbelievable experience, which I call the Disney experience. You have to be better. And I love this quote by Elon Musk: in an oversaturated market, if you want to open up a business, your product and your service and your experience needs to be far superior than your competition. Not better, not just a little bit better, but far superior than your competition. And this is what we have to do. We have to show better outcomes. We have to give them a better experience. You have to get faster results and fewer visits, almost cheaper than standard care. And that's what's going to make you thrive in a cash-based setting. So just to summarize, my FIOMPT lecture, it was a great experience. I wanted to give the wow factor. I hope they invite me back next year. It was an awesome lecture, great experience. I learned a lot. But the 3 main things that I went over were, I went over the direct access rules and knowing your practice act. I went over medical screening, and I gave the example of the VBI and CAD screening, that we are competent in performing medical screening and we know when to refer. And then I went over 5 strategies to help tap into that direct access market. So if you have any questions, send me an email at cashbasedpt@gmail.com, or just shoot me a message on the website and let me know if you have any questions. Thanks.